Today, scientists and doctors know how important it is for people to get care for a substance abuse disorder and a mental illness at the same time. Through a dual diagnosis treatment center, individuals can get a professional diagnosis for all their conditions. Once they know what the issues are, they can immediately start treating them. Are you or a loved one seeking addiction treatment services? If so, then stay tuned to learn about how dual diagnosis could be exactly what you seek. About dual diagnosis. In 2017, an estimated 8.5 million people had co-occurring illnesses. According to the Substance Abuse and Mental Health Services Administration, a total of 1 out of 4 people with a mental health disorder had an addiction. Unfortunately, when people went to get treatment, only 8.3% of people received treatment for both disorders. A dual diagnosis treatment center helps people get treatment for mental illness and an addiction at the same time. Some of the most common co-occurring illnesses are depression, anxiety, and borderline personality disorder. People may also suffer from issues like post-traumatic stress disorder, bipolar disorder, and eating disorders. The warning signs. A person who has dual diagnosis has both a mental illness and a co-occurring substance use disorder. Through top dual diagnosis treatment center programs, clients can learn more about the signs of a dual diagnosis disorder. One of the first indications of a problem is when individuals start retreating from their relationships with families and friends. The individual may also have problems managing their daily tasks or controlling their substance abuse. Time, the individual develops a high tolerance to the substance and starts using the substance under unsafe conditions. They may also neglect their health and feel like they need the substance in order to function normally. With the addiction therapy service centers provide, clients can take the next step in becoming sober. Treatment options. At the best mental health treatment centers, clients can learn more about the treatment options they can choose from. Often, the treatment center will do an initial evaluation to decide the right care for each unique individual. This may involve medication for a mental illness or a recommended stay in a treatment program. The dual diagnosis treatment center may use different therapies like cognitive behavioral therapy or trauma therapy to help the individual change their lifestyle. Group meetings help provide feedback, advice, and support during recovery. Meanwhile, family therapy allows clients to get the support they need to stay sober after their rehab stay is complete. The right care. Through a dual diagnosis treatment center in North Carolina, clients can get treatment for mental health disorders, trauma, and addictions. Whether the client needs an eating disorder treatment center or group support meetings, the right options are out there. When clients go to the top dual diagnosis treatment program, they can find options such as trauma-informed care, gender-specific programming, ecotherapy, and nutritional, psychiatric, physical, and clinical evaluations. You don't have to suffer from an addiction or a mental illness forever. A dual diagnosis treatment center like Red Oak Recovery can help you discover a healthier outlook on life.